Hello, this debate will be about the appropriateness of tele-ABA therapy. Providing ABA therapy through the use of telehealth is a topic that is extremely relevant considering the events surrounding the pandemic over the past year and a half. ABA therapy through the use of telehealth, or sometimes known as tele-ABA, is ABA-based therapy via a computer, a tablet, or a smartphone. It's where you can virtually meet with your BCBA and the therapist to receive services. Clients can receive the same assessments and treatments that they would in a clinic or in a home setting just through a live video conference. We will be discussing the pros and the cons relating to telehealth services in the world of ABA and debating the appropriateness of the service delivery. My name is Victoria, and I am the stator for this debate. I will be sharing the overall pros and cons before and after the debate, and I'll address some relevant topic questions at the end. I'm a teacher in Maryland, and I teach a self-contained ABA program. I plan to graduate from Ball State in December. Up next will be Tatiana, and she will introduce herself.
Hello, my name is Tatiana Castro-Lamley, and I am a high school intervention specialist in Ohio. I work with an alternative in an alternative program with your bottom at 20% risk students. I plan to graduate from Ball State in December and continue my ABA services and therapy. I'd like to bring it into a school setting. For this debate, I will be the pro prover.
Hello, my name is Erica Brown, and I'm currently in my third semester here at Ball State. I live in Lakeland, Florida, and I love working in the ABA field. My passion comes from not only a personal place, but also professional. I currently work as a teacher in an ABA multidisciplinary support program for at-risk youth in our district. And I will be the con prover for this project.
Hi, I'm Hannah Allen. I live in Northern Michigan. I am in my second semester here at Ball State. I am an RBT, and I've been in the field going on 3 years now. In this discussion, I am the pro attacker, and we'll be discussing the pros of telehealth.
Hi, my name is Brittany Shalacta. I live in Delaware. I will be graduating in December of this year. I'm currently an RBT, and I have been in the field of ABA since 2014. I will be bringing up the opposing points to discredit the pro team.
The pro side will consist of arguments saying that it is cost effective, there's increased access to evidence-based services, the ability to meet in real time and in multiple different locations, and there's lots of access to a variety of professionals. The members of the pro side will be Tatiana and Hannah, and they will go into all of this later. The con side will be talking about the possible HIPAA code violations, a lack of access to communication technology, a lack of equity for children who are deaf, blind, or have multiple impairments, and all of the therapy would be through the hands of someone else, not directly from the therapist. The con side members will be Brittany and Erica, and they will go into all of those details more later. Now Tatiana will go over some pros.
There are many positives when it comes to combining the use of telehealth and ABA services. A lot of families with individuals with ASD may be faced with the cost of services being too high. Looking at an article from Gross et al. 2013 and Weiner and Ingersoll 2014, the article discussed how studies are showing that the cost of patient and providers are decreasing while the provider services for coverage are increasing. Essentially, they are saying that they are able to see more patients for less because they are able to use the internet to interact with their patients. Another great point to look at is the access to evidence-based services. ABA services is all about implementing evidence-based intervention to provide the best support for their clients. By utilizing the telehealth platforms, BCBAs and RBTs are able to provide services to their clients and their clients' guardians through the use of technology. The training and the guided practice and the execution of the interventions can all be done outside a traditional therapy center. Next, we're going to look at continuing proving the positives. Looking at an article from Solomon and Soares 2020, it discusses how many children with ASD are identified around age 3. However, in some rural areas, children are not identified until age 7. Some research believes that this is due to the demand of professionals in the area. Some therapy centers are on a 12-month or even more waiting list before a family can get in for services. Some areas simply do not have the professionals within the areas to provide the services. A pro to using telehealth to provide ABA services would be to reaching those families in those rural areas who are losing precious time simply because the demand is too high. Telehealth would and could provide those services to families in their own home. The article by Solomon and Soares 2020 also discusses how telehealth can be a positive for individuals with ASD if transportation is an issue and they're not able to get to the location they need to be. Telehealth allows for multiple specialty providers to work with individuals, which may provide a greater level of interprofessional care and collaboration among professionals. By doing this, ABA providers are following the current ethic codes of 3.02 of medical consultation. They're also following the new codes for 2022 of 2.12, considering medical needs. The code states that behavior analysis ensure to the best of their ability that medical needs are assessed and addressed if there is any reasonable likelihood that a referred behavior is influenced by medical or biological variables. They document referrals made by the medical professionals and follow up with the clients based on that. Another great aspect to look at is the broadband. Broadband is a benefit program that provides internet access at a reduced rate. Families that may have low income, families that may qualify for free and reduced lunches at school, and there are other qualifications and criteria that will allow families to receive these services to help with the ABA services. Next, Erica will talk about the cons.
I will discuss the valid reasons telehealth negatively impacts persons with a disability. According to the article by Anoswamy et al., people with disabled conditions are a vulnerable population with social, economic, and environmental disadvantages. Many live in rural areas, which can be a challenge while trying to access telehealth services. Next, we're going to look at the lack of access to communication technology. First, accessing broadband internet is difficult in rural areas. Then there's operational costs to the service provider to provide resources and a telemedicine platform for clients. The costs will most likely get passed down to the client or family who may already be struggling financially. Then there are logistics and legislative barriers to consider. Traditionally, in-person healthcare partners with ancillary services to provide laboratory testing and diagnostic studies. Persons with a disability, due to their inability to complete those vital diagnostic processes, may find it difficult to basically access the healthcare that they need. There are also legislative issues that may affect the client and telemedicine provider, which I will discuss next. So let's discuss the client's needs. The American with Disability Act address the needs of clients in physical spaces, and they don't include virtual platforms. Virtual healthcare providers must ensure they're protecting clients' rights by providing the necessary accommodations virtually. Most telehealth platforms don't customize their interface to the specific needs of each client. So people with cognitive issues might have difficulties when communicating with their therapist. A lot of people who are disabled, they can't read or write independently, and telehealth lacks the educational tools to help clients learn socially essential skills. Okay, and let's face it, many disabled clients have unique challenges that telehealth services alone cannot fix. For example, clients with autism may need hand-over-hand support to complete a task. A chaining procedure is much more challenging virtually. So we must also consider people with dexterity and mobility problems who might have a hard time interacting with virtual technology. So for the reasons discussed, in-person services is a better solution for disabled people, and Hannah will discuss her points.
Prior to the new 2022 ethics codes, there was not a code for timeliness. With the new technology becoming available, we are being held to higher standards for conducting all services in a timely manner. Code 2.02 states, behavior analysts deliver services and carry out necessary services related to administrative responsibilities in a timely manner. With new technologies such as telehealth, we have the ability to provide diagnostic services, therapy, and many other behavioral health services to individuals who are suspected of having ASD virtually. It is crucial that children who are suspected of having ASD get tested as soon as possible, because an early intervention can improve the quality of life significantly for young individuals. Eliminating a 15-month wait to 11 weeks can dramatically decrease those long waiting periods and potentially provide those individuals with an extra year of treatment and ABA services among many other services. Telehealth also allows us the ability to provide behavioral health services to individuals in rural areas who may not have otherwise been able to receive the treatment they need and deserve. Ethics Code 3.12 states, behavior analysts advocate for and educate clients and stakeholders about evidence-based assessments and behavior change intervention procedures. They also advocate for the appropriate amount and level of behavioral service provision and oversight required to meet defined client goals. We should do our best to offer these services that are needed to clients. Telehealth opens up more opportunities to do so. There may not be a center near the child's home, and there may not be an RBT or BCBA near the child's home to provide the therapy services. If you take telehealth into account, that child has the potential to have someone provide therapy from their home to that child in their own home. Next, we're going to look at the efficacy of telehealth. Telehealth is a cost-effective alternative to in-person therapy and diagnostic services. Families do not need to spend as much money on traveling to and from the center or the therapy location, allowing families that were not able to afford the cost of therapy that were not covered by insurance to receive the needed treatments. Therapy centers do not need to spend as much money on office locations and travel costs of their staff and meetings at a location other than the office. BCBAs may be able to have a larger caseload if they do not have to factor in the drive time into their daily schedules. A BCBA can visit 2 clients back to back without having to travel from one to the other. Following within the ethical codes, the clients have the right to receive treatment that is effective. As behavior analysts, we need to ensure that our clients are receiving treatments designed to show the desired outcomes for the clients. By providing our clients with quality and effective treatments, we are giving our clients and their families the satisfaction they deserve by improving the child's and their family's lives. Our goal is to give our clients a more independent lifestyle and improve their overall quality of life. We can ensure we are making a difference in their lives by looking at the goals we are reaching, as well as the satisfaction of the individuals and their families. Now, Brittany will continue with the cons of telehealth.
When considering telehealth for a client, you must consider the appropriateness of the virtual platform for that specific client. Telehealth may not be the right model of care for every client, and it's imperative we understand that. A code from the new Ethics Code 2.01 states that BCBAs need to prioritize clients' rights and needs in the service delivery, and that they should provide services that are designated to maximize desired outcomes. If a client has needs that can't be met or can't be maximized through the use of a virtual platform, then telehealth isn't the right service delivery choice for that client, and it would be unethical to deliver services in that way. knowing a more face-to-face, hands-on approach would maximize the desired outcome. Now we will look at some additional cons that will be thought about when considering telehealth ABA services. A therapist may have a harder time building relationships with their client. There is no face-to-face connections being made. Every interaction is through a screen, which can weaken patient-therapist relationships. Because there is no face-to-face hands-on therapy provided directly by the therapist, there is a level of delay that needs to be recognized. The immediacy of a reinforcer is so important with many interventions, and if using a parent or caregiver on the other side of the screen to deliver the reinforcer, more times than not, there will be a delay from which you had to relay the message of delivering that reinforcer, instead of being delivered immediately via the therapist, like in a typical clinic or home setting. Another important factor that needs to be considered is the impact that severe behaviors are going to have on the delivery of service through the virtual platform. It may be very difficult to sit in front of a computer or tablet for some clients, or overwhelming for parents to work with their children with severe behavioral needs. Even with the guidance from a virtual therapist, they do not have the hands-on training that may be needed in a crisis intervention moment. Victoria will now go over the closing arguments.
Some of the overall positives throughout this is the accelerated and increased access to the ABA services, and it's cost effective, and there's many cases that it's shown to be effective. Some of the overall negatives, however, whether it's the lack of internet or the lack of the client's needs, it just might not be the right model of care for every patient. Some questions that we'd like to address. The first question is, what is a BCBA's ethical responsibility regarding this topic? And a BCBA's ethical responsibility regarding providing ABA via telehealth is most importantly keeping the same level of standards as we would for any other form of therapy. All codes still apply, and they need to be followed with integrity. Question 2 is, how have recent world events impacted your thoughts on this topic? As a group, we've decided that COVID has drastically increased the awareness and usage of providing ABA through telehealth. Although it came on quickly and may have forced the hand of many therapists to begin using it, we are lucky to exist in a technology advanced world where we were able to adjust our services and provide them in a time of need. Do we have any personal experiences related to this topic that we'd like to share? Many of us in our group have experienced providing services virtually this past year. Although there were many pros and many cons throughout our debate, it makes it difficult to say how appropriate it really is for everyone. We are glad that it is another available resource that can benefit some individuals. Thank you for listening to our debate on telehealth and ABA, and we are finished.